Big Biz Show continues inside the Loft 100 studios here in now sunny Southern California. Had a lot of rain last week, but it is beautiful outside. Also beautiful is the Day Trader Trio right there on stage live, no less than self-taught. Back here at the bar, it is Costa and it is Mary Burt Godwin. Perfect. Nailed it.
Nice work.
I don't even have to tell them anymore.
No, I was like telepathically ended it.
That's right, because I'm big in the music industry as well, as far as my talent is concerned. Trace, I totally heard that right in my ear. That was a groan.
He didn't even try to hide it. No.
Yeah.
Internal monologue.
Yeah, zero. While the rest of the country is dealing, the East is dealing with a nor'easter.
Tundra, yeah.
We're out here just living it up in the
70
sun.
degrees, I believe.
It is beautiful.
Yeah.
Our next guest is a Maryland kid, so he certainly knows what a nor'easter is all about. Jim Joyce, the CEO, he's also an inventor, CEO of Sigyn Therapeutics, their ticker symbol. SIGY is back here on the Big Biz Show. Jim, you've battled a snowstorm or two. You're also a former Denver Bronco. And what does they say in Denver? If you don't like the weather, stick around for 5 minutes, it'll change.
Oh yeah, amazing how quickly it can change. Snowstorm one day, 72 and golfing the next.
Jim, let's talk about the recent introduction of cardiodialysis. It's a first in industry blood purification therapy to help address cardiovascular disease, the lead cause of deaths globally, which blows me away. And Sigyn is right there trying to do their thing at the tip of the spear.
Yeah, it's a frightening disease condition that creeps up on many people. It's been the number one cause of death in the United States for more than a century. We are building off what I did in my previous company, which was to develop the first blood purification therapy to treat a pandemic virus. Was cleared by FDA. But now with cardiovascular disease, we recognize that there's the ability to reduce the circulating presence of lipoproteins that transport cholesterol. These are the targets of leading drugs to treat cardiovascular disease. We've developed cardiodialysis to address those targets and simultaneously reduce the circulating presence of inflammatory factors that fuel the progression of cardiovascular disease. And the intriguing aspect of this is the potential ability to benefit patients and save tens of thousands of lives each year. At present, drugs such as Lipitor, LDL-C reducing statins, they reduce major adverse cardiovascular events by about 25%, whereas devices that can reduce the circulating presence of these factors have demonstrated and been published in the American Heart Association journal the ability to reduce major adverse cardiovascular events by upwards of 75% and greater.
Amazing.
Now, Jim, does it matter what the triggering cause of the inflammation is? As far as I know, it's, a lot of times it's diet, sometimes it's hereditary, stress, all sorts of different factors. But your treatment, this cardiodialysis treatment, would take care of the problem regardless of what triggered it in the first place.
That's right. Regardless of the source of the origin, we are addressing the targets that not only induce cardiovascular disease, but actually promote cardiovascular disease. So the origin, in many cases, it could be somebody with a heretic predisposition to suffer from this condition. It could be somebody that is suffering from cardiovascular disease as a result of diet. There's a wide range of causes, but we've been able to develop a technology that can reduce the circulating presence of not just the lipoproteins that are transporting cholesterol, but again, the critically important inflammatory factors that fuel progression. And the upside of our technology, which makes it a real breakthrough in industry, is it's designed for use on dialysis machines that are already located in more than 7,500 dialysis clinics in the US alone. And the previous devices I mentioned, they are not well known. because they're hard to find. They're not geographically convenient. They're only located at 54 specialty apheresis centers here in the United States.
Jim Joyce is the CEO of Sigyn Therapeutics Incorporated. Their ticker symbol is SIGY. Jim, as far as that and helping out, dialysis, kidney dialysis patients and attacking the cardiovascular disease itself, like you've been talking about, will you ever get it to a point, or do you hope of getting it to a point where these machines, as far as size, shrink down where they can almost be portable for someone to take with them into a house? Or is that an impossibility?
No, that's a good question, Mike. Our device is blood in, blood out.
Okay.
So we don't require a lot of the bells and whistles of a dialysis machine, but there is an emergence in the dialysis industry of home dialysis. And one of the challenges of home dialysis is that they have dialysate that they all have to administer in addition to the dialysis cartridge itself. So we eliminate a lot of those moving pieces. But yeah, you could envision in the future that patients could go to dialysis centers. But in the future, this could evolve to be an in-home treatment where it's conveniently delivered in the privacy of your home. The other thing I'll point out, because you brought up the dialysis industry, there's over 550,000 dialysis patients in this country that suffer from end-stage renal disease. And these are dialysis-dependent individuals. They're typically being treated 3 times a week, 4 hours of treatment, and they suffer from high rates of cardiovascular disease. 67% of dialysis patients actually die from cardiovascular disease. Wow. It's driven by their response to therapy, which creates a chronic loop of inflammation over time. So the ability to not just treat these people, but to include our device in series with the regularly scheduled dialysis treatments, it's a great launch pad for us to kick off commercialization potentially in the future.
Hey, Jim, I think we only have about a minute, so this might be too long of a question, but did I see on your website that you also have cancer therapies and chemotherapies and other types of things with people afflicted with cancer?
Yes, we've developed cardiodialysis from theoretical concept to the clinical reality of it being prepared to move into the first-in-human studies in cardiovascular disease patients. In the backdrop, we've developed a pipeline of technologies to address cancer. Probably the most compelling therapy is our immune prep platform to improve the delivery of immunotherapeutic CAR-T drugs.
Wow.
Jim Joyce, CEO, Sigyn Therapeutics, ticker symbol SIGY. Jim, always appreciate the time. We also appreciate your time every episode of The Big Biz Show, and that is it for today. Thank you for being along for the ride. We'll see you next time.